In addition to phone apps, mobile health takes many forms. Joining me to explain mHealth, what it is, and how it is connecting doctors and patients in new ways are Melanie Hingle, the chair of the University of Arizona Mobile Health Special Interest Group, and Jonathan Sprinkle from the UA Department of Electrical and Computer Engineering. Well, thanks for being here.
Thank you for having me.
This is an exciting topic. But what is it all about? Why don't you start out by telling us what mobile health is?
Sure, it is the practice of medicine and public health with the assistance of mobile devices. And by that we mean tablets, phones, anything that you can pick up and take with you.
And why are you so excited about it? Why is this something you're focusing your efforts on, both of you?
For me, it's a chance to make impact, to have the ability to help someone or to make some new application that will help someone transform their health. And that chance is really made possible by the fact that these devices can go anywhere, and that changes the game for most physicians.
So walk me through this a little bit. Give me an example. How would I use this?
Sure. I think the best way to think about this is that it is a tool. So mobile health is a tool, and you can customize it depending on what your needs are. So if you are a researcher, such as myself, I use it to reach participants in research studies that we enroll with healthy lifestyle information. I'm in the Department of Nutritional Sciences, so we promote healthy eating, physical activity, and we do so with youth and families, and we do that through phones, text messaging right now primarily. There are different examples out there.
So what do you mean text messaging? You're sending me a message, don't eat that donut! What is it? What does that mean?
Not quite like that. So we use participatory methods. So we actually involve the kids and the families every step of the way when we're developing a program. And we have them help us make the most effective messages. So they actually help design them, they help us test them, and in the end, hopefully it's more relevant to their lives.
So this is an interesting marriage between computer science and medicine. How does that work? What are your challenges there, bringing this together?
Probably the biggest challenges as computer science and engineering is to know what's an important problem that I can actually be working on. And this is a chance for people on the application push side, like engineering and computer science, to say, I know now what the important problems are because I've talked with people in the healthcare industry or people, for example, in nutrition science that know this is an important problem. I wish I had a technical solution. We have the technical solutions, and now we can marry that to the problems that need to be solved.
Mm-hmm. And I cannot build applications. I'm not a software engineer. I'm not a computer scientist, but I know what types I'm looking for, and so I can go to Jonathan and our other colleagues in computer science and engineering and ask them how to create something, and they can do that for us. So that's really what this group came out of. It was very multidisciplinary, and it arose from a collaborative group that discovered that we all have each complementary talents, unique talents that we can bring to the table and create something that we hopefully will have a great impact across the population.
And is this a fad? Is this something that we're seeing move out into the community and here to stay, or a fashion?
Well, think of how many people use apps, and there's a very large percentage of the population now with smartphones, which are the kind that you can load software apps on. They're not just fun and games. They actually provide health information, and quite a few people, majority of people, have used their phones to access health-related information, and so that's absolutely something that we want to help promote and get good information to them.
And what about the face-to-face relationship with doctors? Are you concerned at all that that might start breaking down?
I'm not really worried about that. For the most part, the kinds of things that we provide in these apps is the ability to capture data and know when and where that data was captured. This can actually improve the interaction between a physician and the patient, because sometimes the patient may feel like, well, I forgot to write all those numbers down in my book last week. Let me just write them all down now. And that can actually make them feel like they're doing the right thing to their physician, but it can lead to inaccurate diagnoses.
And so do you think that people might actually get more overwhelmed by yet more data that they're having to deal with? Talk to me about that a minute.
That's a great question and an issue. There are companies out there right now. There's one called Haptique that is helping evaluate the quality of apps that are available to the general public, because there are a lot of ones that don't give you good information. And so I think that's a very important thing to consider is what type of information. And we're going to see more of that coming out in the future to help us make decisions.
And what kind of apps are you thinking you're going to start seeing?
Well, we have ones right now that allow you to track different health indicators like physical activity and nutrition, but it's how that information is fed to people. So right now, too much information is not good. We need the right type of information at the right time, and that's where we're seeing our efforts.
That's super. Well, thank you very much indeed for coming in today.
Thank you.